Hey everybody, this is Dr. Sean Patterson, and today we're going to do drugs. I'm sorry, today we're going to discuss drugs, whether they are good or bad. I think I should stick to my notes so I don't do that again. Um, Drugs. We tend to look at them black and white. I'm talking about more prescription drugs, although we can get into another conversation about recreational drugs because they can be good and they can be bad. But today I'm speaking more about prescription drugs, things we take that doctors prescribe to fix illnesses. Um, because a drug can be good and a drug can be bad. And I'm not going to be extreme. In fact, I know extreme people. I've worked with patients over the years. I've seen people healed of cancer. I've seen people who have cancer eradicated from their body using both natural and artificial means, drug means and natural means. And there really is a different long-term outcome for those. And I'd like to just spend a few minutes talking about those. But the extremes of drugs, some people um, they are not going to take a drug no matter what. They can have the worst migraine on earth, and they will go and find a dark room and lie there for 7 days with cold towels on their head, throwing up every hour, and write it out because they are just not going to take a drug. And then there's other people who are going to, if their child sneezes, they're going to pull out the Benadryl and the inhaler and the allergy medication, and they're going to be on the phone with their allergist specialist at the Mayo Clinic within an hour of that sneeze. And of course, those are the extremes, and that is not normal. But kind of joking around, we are kind of like that. I know people who they would scale up the Himalayan mountains for the magic berry that would cure cancer before they do chemo. And then there's people who would jump to experimental drugs before they really do what I would say their due diligence because they trust their doctor. And I'm not saying that's bad. I'm just saying it's a paradigm shift, or I'm sorry, a paradigm. A paradigm is really just a pattern for something or a model of something. Okay, so when I say paradigm, it's just your model or your pattern for how you do whatever it is we're talking about. So my paradigm for health is I believe I'm a self-healing human. I'm a self-healing organism, meaning if I get a cut, I know that cut's going to heal barring an infection, or I cut my finger off or something extreme. But if I get a cut, I'm going to heal. If I get a cold, I'm going to heal. If I get an infection, I'm going to heal. If I break a bone, it's going to heal naturally. Now, are there times for intervention? Absolutely. But I'm going to go through the gamut of what I know first. For instance, let's just start with basic things like back pain. If my back hurts, what I'm going to do is I'm going to ask myself, did I do anything to cause trauma? Now, I did some yard work yesterday. I spread a few yards of bark around. My back was definitely tired when I was done, but there was no pain or disability while I did it. So it wouldn't be normal to wake up today with back pain and say, oh, I must have hurt myself yesterday, because that's not how the nervous system works. If you're going to hurt yourself, you're going to hurt, and if you're not, you're not. But we do that every day with things. We'll wake up with a headache or a shoulder pain or back pain, and we'll try to analytically, logically reverse engineer what may have caused that. And that's kind of a paradigm that doctors use, and we'll call that things like tendinitis, bursitis, arthritis. A medical doctor would diagnose those things, but really it's just back pain. So my paradigm is to assess, well, neurologically that doesn't make sense because I didn't do anything where my brain said, stop, you're hurting yourself. So I would say, gosh, okay, did I over-exercise or under-exercise this last week? Am I eating things I shouldn't be? Are my emotions well balanced, or am I really worried or hurried? What's my schedule like? And I'd go through this whole kind of, this whole gamut of things that could cause stress. Okay, because in my body that causes back pain. Now, other people's paradigm is back hurts, go to the doctor. Doctor says you have a sprain or strain, you need an adjustment or an ibuprofen. There must be an ibuprofen deficiency because I get that recommended to people a lot with pain. And I guess the theory is you take some ibuprofen and it clears up the problem. But that's me trying to be funny again. But the reality is we have different paradigms of what we do, and that paradigm is really important. So if you have a paradigm that if you have cancer, you need chemotherapy, it may be better for you to get chemotherapy, because if you go try to do everything natural and your paradigm is more medical based, you're going to create a lot of stress in your body. And the opposite's true. If you really feel like I've been given grace to get over this naturally and I'm going to let my body heal and I'm going to change my lifestyle, and then you go get chemotherapy, there's a good chance that chemotherapy is going to be more toxic than ever to your body. So it's important to understand what paradigm means. So when somebody comes into my office, I first have to understand, what is your paradigm? So you listening to this right now, what is your paradigm? It's a great thing to write down. And there's no judgment and you're not in trouble. It's just what it is. It's probably it has to do with your background of mother, father, teacher, preacher, what you learned growing up. Your paradigm is going to be reflective of that. And then we have our own inborn kind of intuitive spiritual side that just says, hey, that's not good for me, or that is. But the thing is, we also need other people to help chime in on that at times, because sometimes we can be deceived, or we can be unconsciously afraid of something, and our paradigm shifts to the path of least resistance. So write down what's your paradigm. What would you do if you were sick? Are you somebody that would try something naturally? Are you very fear-based or high anxiety? Does it get you and grasp you to where you couldn't go a year doing something naturally because you'd be so afraid that it was going to get worse or you were going to be overcome by it? So what is a drug? I mean, a drug really just is a compound chemical, patented chemical that gets into your body and has a physiological effect. Food is not a drug because it's not a patented chemical. If pharmacies, if drug companies could patent nature, they would, but they cannot. So they have to take something and tweak it just enough to be able to make it in a lab, and then they get a patent for it, and that is their patent, their drug. And then generics obviously will knock those off once patents expire and things like that. But the one thing that's really important to understand too with your paradigm is, because it drives who you see when you're ill. So today, I had a patient who came in and his digestion's off and his back's hurting him, and he's a very intuitive guy, and he says, hey, I've been wrestling with my kids and doing some things I don't normally do. However, there's a whole lot more going on, and went into talking about some stresses and things like that, because his pain was completely healed and gone, and then all of a sudden it came back with no real trauma. So his paradigm is to come see a guy like me that could do some chiropractic techniques, acupressure techniques, talk about emotions, talk about food, talk about toxins, talk about marriage, talk about kids, talk about Thanksgiving, talk about all the things that really are the root cause of that. Chances are pain will be gone before we even get started with that. If your paradigm though is, oh my gosh, my back hurts, I must be injured, I go to my medical doctor, chances are you're going to get physical therapy or drugs, okay? Which I'm not here to judge whether that's good or bad for you, but if you continue that cycle and your body continues to have a chronic pain, there's a good chance that those drugs are just medicating it away. They're not fixing anything. It's kind of like when you drive your car. Let's just say the check engine light that comes on is the same thing as your back pain, or your migraine, or your insomnia, or your depression, or your, just fill in the blank. Our bodies are all very different genetically, and we all have different expressions of stress. That's why so many people struggle with different things. But a stressed body typically does struggle. And like I said, it doesn't matter what your flavor is, it's all ice cream, right? Whether it's depression, insomnia, anxiety, or it's more physical like bursitis, arthritis, chondritis, tendonitis, tennis elbow if you don't play tennis, those kind of things. There's all kinds of problems, gut problems, rashes on the skin, eczema, psoriasis, losing your hair, gaining hair in places you don't want hair. There's all kinds of things, but those are symptoms. So you're driving your car, your check engine light comes on. That's your symptom, okay? Just making the light go off is not the solution unless that's your paradigm. If you really don't care of a deeper meaning, continue doing what you're doing. Maybe drugs and surgery are best. But if somewhere inside there you go, I feel like there's a deeper thing. Maybe that check engine light means something else. You plug in your little computer and you find out, oh my goodness, this is a mixture of some improper thinking I learned as a kid, a lot of nutritional stress, my blood sugar's off, my adrenal glands aren't working right, and I've been eating too much high fructose corn syrup and yellow number 5 food coloring. That may cause somebody's check engine light to come on, which is really their set of symptoms. So What I do in office is I like, if your paradigm is somebody like me to dig a little bit deeper, I like to do a bioelectric impedance analysis and a consultation in the office where we're looking at mental stresses, we're looking at body fat percentages, lean body mass, we're looking at how much water's in your body, where's your water at, do you appear to be toxic, what's your body shape, what's your body type, what's your blood type, because then we could paint a picture of, oh, out of these 10 criteria, these two really need some work. And most of the time, when we fix these two, the body goes back to being its self-healing organism and it fixes its own problems like insomnia, depression, gut problems, back pain, migraines, headache, sugar cravings. And I don't diagnose diseases. That is not my license. That's not my job. And I don't even believe in diseases being diagnosed. I believe they're symptoms and you work backwards. In fact, a guy named Dr. John Sarno, Sarno, brilliant doctor, brilliant author. He's a medical doctor in New York. He's in his 90s. I still believe that he is alive. He wrote several books on psychosomatic pain disorders, meaning pain that comes from parts of your brain that cause real pain, real symptoms, real debilitating in all walks of life, whether it's a stay-home mom or a business executive or a child. He found that there are parts of the brain that will cause these problems. So that's one of the things we're looking for as well. Really important to know the root of your symptom. And so once again, drugs are good in a pinch. I'm on a camping trip. I don't have a chiropractor, massage therapist, my special Himalayan berries laying around. I've breathed, I've stretched. I can't get rid of my headache. Pop an ibuprofen for me. I'm okay with that. My conscience is great. I went through my protocols. It falls in my paradigm. Now, if I haven't done those things and I'm finding myself taking 4 ibuprofen a day, I really have to start thinking, what is going on with me? And I try not to even judge myself. Okay, maybe I have to do that for a few days in a row until I find out what's really going on. And that's the key, finding out what's really going on. Emotions, allergies, toxins, nutrition, structure, electromagnetic pollution. It's really important to find out. Nuts and bolts though, you guys, get your adrenals tested as well. Salivary hormones. You want to do a spit test to look at your cortisol, progesterone, testosterone, estrogen, DHEA. It's called an adrenal hormone profile because that is your body's ability to deal with stress. You don't want to be taking drugs for things like allergies and pain and skin problems and depression if you come to find out your adrenal glands are just not working right and they regulate your stress hormones and your sex hormones. And if you would just rehabilitate those, all those other problems go away. Because if you don't rehabilitate those and those are the problem, those drugs are just going to compound and make things worse. Okay? So establish what your paradigm is. And if your paradigm is digging deeper, that you feel the body's self-healing, really use health professionals that will look at that full gamut. And it's got to be the full gamut, everything from lifestyle, your schedule, your mind, your thoughts, your food, your toxins, your allergies. Somebody like me, if you're not in my area or we don't gel, I'll refer you. I would love to get you to the right persons to help fit your paradigm. Okay? So hopefully that makes some sense and that you have a terrific day. And by all means, send me an email or a text message to the office if you have any questions or concerns. And we'll look forward to seeing you next time. Thanks so much. Bye-bye.